Welcome to your On TV News Desk. I'm here this afternoon with Lisa Vezeau-Allen, who is a Ward 2 candidate in the upcoming election. And the date's coming up pretty quick.
The date is coming up pretty quick. October 22nd.
Yeah, so now would be the time to start if you haven't yet, doing your research. So, you sent us some information on your stance on crime and the opioid crisis in Sault Ste. Marie, and, of course, broader to a lot of Canada and the U.S. as well. Now, something that I found when you and I were just talking about this was that there's not a task force here in Sault Ste. Marie. From what I can see, there's not a task force dealing specifically with the opioid strategy. But when I was looking at something the Northeastern Local Health Integration Network, the LHIN, sent out in January 2018, and they said that they will be working with opioid task forces in LHIN's subregions, and Algoma was included. But then when I looked for more information, I couldn't find anything on a local task force here. So do you know where the Sault status is on that?
I don't. I do know that we do have the Rapid Access Addiction Medicine Clinic. Which just opened.
Right.
Through Sault Area Hospital. It is located on East Street. And I posted the number for people to call to get help. So that was the one thing that I was finding in talking to people in the community was about drug use in general. They're like, there's no help, there's no clinic. I'm like, well, yes, there is.
People just don't know about it yet.
People just don't know about it. So that model came from Sudbury. It's the same model that Sudbury is using, and it is through the LHIN. So we have that. But to counterpoint, the opioid crisis, it's not just the opioid crisis, it's also drug addiction in general, how it's connected to crime, and how all of that trickles down to poverty and homelessness. So, and my philosophy is to create a healthier community, which is one of my priorities, because it is a priority for a community to thrive.
Absolutely.
Is there needs to be a task force combating all of those interconnected issues and creating awareness and creating knowledge, and also creating what each organization is doing. I've worked in the nonprofit sector for so long, and we tend to work in silos.
Absolutely.
And that, is slightly changing. We see a lot of organizations working together at the Neighborhood Resource Center, which I think is, an amazing hub. But there's other institutions that can come into play into this whole, how do we really address the issue and be honest about it. I think that's the other really key piece.
And I think that is a key piece, as well as the fact, and this came to light post Steel Town Down documentary, is, what are the actual numbers? Because what SAH is reporting, what Algoma Public Health, and what the police, if it's not all consistent, then we don't have an accurate picture.
No, so what we do know right now, and this was the Algoma Public Health report that just came out, they reported in 2016 15 deaths. And that's all of Algoma District. So that's a population of over 113,000 people. So out of that population base, there were 15 reported deaths in 2016 due to opioid overdose or opioid use. What they also know is that hospitalization due to toxicity due to opioid use is 45.7% per 100,000.
Okay.
So that's high.
Yeah.
That is high.
So just because people aren't necessarily dying, they might be overdosing on a regular.
They could be overdosing. They have too much of it in their system. They need to be hospitalized. The counterbalance to that is our poverty rates. So the age cohort between 18 to 64, 16.1% live in poverty. 5 to 18 years of age, 22% are living in poverty. So there's a direct correlation between poverty and drug use, and then there comes your crime. So, while we're saying we want to address the drug use, it's not just that. It's all interconnected.
Absolutely.
And it needs to be a cohesive, collaborative approach into addressing all of that to have some solutions.
So something that came up on that note in what you sent us was something that the Canada's Chief Public Health Officer, Dr. Teresa Tam, said, and that's that poverty and homelessness are among the chief causes of an opioid crisis. But many Canadians simply don't see the effect. Now, do you think we're guilty of that here in Sault Ste. Marie?
I think every community is guilty of that. So in Canada, we have 11 deaths per day on average due to an opioid overdose.
Right.
And that's through, the stats federally. So we know that this happens. We know that there's always been a drug issue in Vancouver. There also are drug issues in Calgary. There's also drug issues in Windsor, Ontario, where I used to live. My point is we are not alone.
Right.
Northern California has enormous
The states
amounts
are suffering.
And I just moved back from Boulder, Colorado. And what's happening in Boulder, even though there's a high rate of people doing really, really well because of the tech industry and the software industry coming in, there's that whole other reaction to that, is that people can't afford to live there because housing prices have gone up
anymore.
There's homelessness, there's poverty, there's an enormous amount of drug use, there's lots of people living on the streets.
Right.
So we're not the only one. So it's also looking at like communities. So the model we have here is the model they're using in Sudbury. Dr. Tam also goes on to say that safe needle exchange is a proven model. And it was interesting last night. We had a meet and greet at the library for Ward 2 and Ward 1. I was just at the Ward 2 one, and one woman, and it was really, really makes you pause for a moment. So her point was, if we're going to do safe needle exchange for drug addicts, what about diabetics that can't afford their needles? So
that brings up this whole other issue.
That brings up a whole other, yeah.
And it relates to the issue of healthcare.
Exactly.
Now, we're going to take a short break, and then we're going to be back here with Lisa talking about the opioid crisis and how she hopes to address that moving forward if she's elected onto council. Stay tuned for more after this. And we're back on TV with Lisa Vezeau-Allen talking a little bit about not just opioids, as you said, the issue of drugs, poverty, and homelessness in Canada, but specifically here in the Soo. So before the break, we talked a little bit about how we need a number of agencies to come together. We need law enforcement, addictions counselors, justice, medical professionals, social services, and city reps, because this issue is broader than simply drug use.
It definitely is broader than that, and it's also, we can't blame one agency or the other agency. It's all about working together and understanding everyone has their limitations. Everyone has their own mandates. They have their own work that they can do or can't do. So it's where are the gaps. As a grant writer and as someone who's worked in nonprofit, it's always about finding the gaps and where is the evidence. So that really is what needs to happen. I was on the community committee on graffiti. So there was, an issue with nuisance tagging. So we said, okay, let's have a task force. And that was led by Councillor Myers and Councillor Butland with, Public Works, with the art gallery,
people who are involved.
With the Arts Council. I was ED then, with Nordic Institute, with some community members at large, really coming together. And that's when we ran the Graffiti Reframed project out of the Neighborhood Resource Center.
Right.
And it was more of an educational tool, but also it was a research piece as to when you bring people together and beautify a neighborhood, what can happen.
It becomes an outlet.
It becomes an outlet. And this is the same thing. How can we create a better environment for people living in this city so they're not turning to addiction? You're always going to have crime and drugs. You're not going to eradicate that in any city whatsoever. So how do we decrease
put a limit
and how
on
do
it.
we have the safeguards in place so that people can get help, that people can get housing, that people can get sustainable jobs that pay a living wage? So it's all those key pieces that come together, and also not being judgmental.
Right.
That is something that I've also got at the door, totally related to a person that has international students living at their home and works with local immigration, and said, we can be nicer to newcomers to this community, even though we're being known as being very friendly. When we have the unknown, I think we tend to be a little afraid of
standoffish.
That. Yes. So I think it's the same. It's not being judgmental. That person has a problem. So it's in our best interest as a community to be compassionate and understanding and to try to get them the help that they need.
Now that kind of brings me to my next question. Because like you said, we're guilty kind of that here, of this, certain perception, turning a blind eye, but many other cities are. It's not just us.
Yes, it's sort of the Canadian thing too.
Right.
We're too polite.
But What difference do you think a change in perception alone could make here in the Soo in terms of how we approach homelessness, how we approach poverty, how we approach those who use drugs?
It was interesting. This was done quite a few years ago. In Pauline's Place, which is the local youth shelter, did a documentary, and it put a face to those.
Personalized it.
Exactly, and I think that's really what needs to happen. I'm not dismissing the W5 expose. Like, those are real people at the real situation. So we don't know what is going through in someone's life. We don't understand what struggles they have. So I think that's really important, is that it could be any one of us.
Right.
It could be any one of our children, any one of our family members, any one of our friends. So it's creating that environment where people are like, oh yeah, that is somebody I know.
And it's not just affecting, I think that's a common misconception that I came across through studying this topic when I was writing about it after the W5, is that it's only affecting this, a lower class or people of lower socioeconomic status.
No.
And that's something that unfortunately the W5 documentary didn't portray, is, well, there's professionals, there's nurses, there's people that you might not suspect that don't look like your classic drug user that might be suffering.
And that is across the board in any community.
Absolutely.
Because you have to have money to buy drugs. That is the reality. Or you have to have the connections, or you have to have the ways. I cracked my rib 3 years ago, and immediately the doctor gave me an opioid painkiller. I took one, and I was like, I feel awful. I'll just survive on Tylenol 3. So that's how easy, though, I got a bottle of drugs.
Yeah.
And I disposed them in a safe, the pharmacies would take those and dispose of them safely. So, but what if?
And people with addictive personalities.
Exactly. What if I, went through that bottle and needed to find another one? So, it happens. It happens, and I think we need to, as a community, take a look at where we are failing some populations, where we are not being open to those populations. And I think one wonderful thing that's happening right now is the James Street Market.
Yeah.
We're all the same. We're all equal, and we need to bring revitalization into every part of our community. Whether, if the scenery is a steel plant, you know what? The steel plant is what many of our families survived on and were able to thrive, and how the second generation got university education. So before you dispute the scenery of Algoma Steel, I think it's wonderful that that's happening, and that's a really critical part of our history.
Absolutely.
And that is part of it. So that's part of how do you combat the drug use, the crime, the homelessness, the poverty. You embrace people living in those supposed neighborhoods where all the bad things happen.
And that's why I think, too, and you spoke to it earlier, that what the work being done at the NRC is making huge strides forward.
And there's other organizations, right? Like Algoma Family Services is working hard, Canadian Mental Health, John Howard Society, the YMCA, there's so many organizations that can all come together and work together and really make some wonderful things happen when you're looking at dealing with those sort of societal issues.
Great. Well, thank you so much, Lisa, for sharing your thoughts with us. No problem. And we will be back with more news coming up on TV just after this break. Stay tuned.